Boys Town was founded in 1917 to change the way America cares for children and families. Today, we continue that mission by providing a wide variety of child, family, health, and community-based services within an integrated continuum of care. The main problem faced by parents who want to help their children with behavioral problems is that it is difficult for them to find the right care at the right time. Access to care is severely limited, and programs rarely link to one another with a common treatment method, philosophy, or language. Healthcare and youth care programs exist in silos that don't easily allow a child to move from higher levels of care to lower levels, much less to return home successfully. This leaves parents confused, frustrated, and hopeless. Boys Town services are easy to access, and they are designed to help children and their families heal in body, mind, and spirit. Hundreds of thousands of kids and their families call our hotline or go to our website each year for advice and counsel. Boys Town's Common Sense Parenting programs are offered at community-based sites across the country. Boys Town in-home services help tens of thousands of parents to learn new skills and create a healthy environment for their children in their own home. Boys Town has embedded high-quality outpatient behavioral health experts in our pediatric clinics that help most kids get better without the use of psychotropic drugs. Children with more severe behaviors will find that our out-of-home, foster, and residential care use the same treatment philosophy and language that we teach to their parents, ensuring a more successful re-entry back into the family. Each year, Boys Town programs touch the lives of over 1.6 million people across the country, including more than 120,000 children and families that receive direct care through our youth, family, health, and community programs. Boys Town's primary objective is to provide families the very best care possible for children with behavioral health problems, especially those who have been abused, neglected, or abandoned. Our second objective is to promote systemic change so that an integrated continuum approach is available to every family in America that needs help with their child's behaviors. To put it simply, Boys Town keeps families together, gives desperate kids hope, and helps parents succeed. Boys Town keeps families together by identifying and addressing family problems early, before they reach a crisis stage. Boys Town gives desperate kids hope by teaching them the skills they need for success at home, in school, and in their communities. Boys Town helps parents succeed through a variety of resources that promote a positive parenting approach that every parent can easily access. To achieve our mission goals in the next 10 years, Boys Town must use research and experience to improve the services we offer. We must partner with other organizations that can adopt and replicate our research-proven programs. We must increase public awareness of our work and translate that awareness into public policy changes that help parents find the right care at the right time for their children. The first leverage point is that we measure the impact our programs have on children and families. Both our healthcare and youth care research groups have published results in scientific journals and have hosted national seminars that have influenced systems of care in America for decades. The second is our integrated continuum of care. Boys Town is in a unique position to link these worlds of healthcare and youth care to provide stronger services for children and their families that are holistic and comprehensive, healing body, mind, and spirit. The integrated continuum links research-proven programs that share a common philosophy, treatment methods, and language. The third is that Boys Town programs are replicable. Lots of successful programs will claim that they have the answer to the problems of America's kids. They are able to make a great impact on a small number of kids, but no one seems to be able to replicate their efforts. Boys Town has not only replicated its programs at our sites across America, but has created program fidelity models that help us to train other agencies to recreate our success. Boys Town is effective because we understand the needs of America's children and families and have developed a well-defined strategic plan with metrics that measure our success. Boys Town is effective because we have our finger on the pulse of America's hurting families. Boys Town is a nationwide agency with sites across America that serve children from almost every state. I personally eat in the homes of our kids every week. Boys Town has used this knowledge to create a well-defined strategic plan. Following this plan, Boys Town has doubled the number of children and families we directly serve in just 5 years, and has gone from serving 70% of those kids outside their homes to serving 70% right in their own homes. This is a radical culture change that we have accomplished internally, and that needs to happen in every state in America. We can show them how to do it. First, Boys Town uses research to measure the effectiveness of our programs. Boys Town uses longitudinal research to study how effective our programs are over time. In our residential programs, research indicates that former Boys Town foster and residential care youth grow into productive members of society and do better as young adults than their peers who receive care in other programs. They are also less likely to be truant, get arrested, or use drugs and alcohol after they leave our care. Research on our Boys Town in-home family programs shows that 91% of families that receive our services stay together, and 96% say that Boys Town has made their family stronger. Boys Town uses satisfaction data from key stakeholders and hard outcome data to prove our impact and improve our services. The second set of metrics that help us track our success are found in our strategic plan. Each initiative has a timeline, milestones, and clear measures of success. For example, we have shown success in influencing other agencies to adopt our integrated continuum approach, and have worked to include language supporting a continuum in several pieces of national legislation. Using these metrics, we can show concrete data that Boys Town is, in fact, changing the way America cares for its children and families. People are sometimes surprised when they learn what Boys Town is and what we do. Many do not know that Boys Town started out in 1917 as a little orphanage in Nebraska, but is now one of the largest child and family service organizations in the country, with sites across America. Boys Town helps boys and girls, and 70% of the kids we serve never need to leave home to get our help. Boys Town is a leader in reforming the child and family care system nationally. Our Boys Town National Hotline has received more than 8 million calls, and our website gets over 600,000 hits a year. The Boys Town National Research Hospital is internationally recognized as a leader in the treatment of childhood communication disorders, and is also beginning to do whole brain research using an MRI to learn more about how kids' brains develop. Boys Town is faith-based, but non-sectarian. We encourage youth and families to develop their spiritual life and participate in whatever religion they choose. I'd like to tell you a story about a kid named Johnny. Johnny came to our Boys Town campus a few years ago from Brooklyn. He walked up to me at a football game on the sidelines and said to me, "Father Bass, you should be real proud. You run a real safe place here." And I said to Johnny, "So what is it that makes you feel safe here?" He responded, "The squirrels. You see, where I come from, we pick up rocks and chuck them at the squirrels, and they run for their life. But here, they come right up to you. You could feed them with your hands. Heck, if the squirrels are safe, everybody's safe. 'Cause peoples, you can fool peoples, but you can't fool a squirrel." Boys Town helps kids like Johnny to find a safe home where they can heal in body, mind, and spirit. Through good times and bad, since 1917, Boys Town has provided quality, life-changing care to America's children. Kids just like Johnny. The village of Boys Town has been named one of the 100 best communities for young people by the America's Promise Alliance for 5 straight years. Boys Town's National Research Hospital is internationally recognized as a leader in the treatment of childhood communication disorders. We are now using our research capability to study the effect of our behavioral programs on the brains of children using our MRI. The Better Business Bureau Wise Giving Alliance has named Boys Town a Wise Giving Alliance accredited charity. Charity Navigator, one of the nation's largest and most respected charity rating systems, has awarded Boys Town its highest 4-star rating for the sound management of its finances. The Boys Town National Hotline has handled more than 8 million calls, including more than 37,000 calls in which a suicide in progress was prevented. Boys Town has authored countless success stories in which children and families across the country have found hope, healing, and a brighter future. Kids just like Johnny. The toughest challenge for Boys Town is to first discover and then to meet the changing needs of America's hurting children and families. As societal, economic, and other pressures have created more serious problems in the home, Boys Town has worked tirelessly to develop innovative, effective approaches and services. Another tough challenge for Boys Town is the broken system of state and national funding for children and families. Simply put, funding exists in service silos that are difficult for families to access and that have no financial incentive to move kids to lower levels of care or back home successfully. These silos are also wasteful of precious government dollars because of the cost of moving a child from one level to another. Even worse, each level of care uses a different philosophy and language which confuses the kids and families and slows their recovery. As budget pressures increase, agencies find themselves fighting over scraps and cutting costs, which jeopardize program quality. Boys Town's answer to this problem is an integrated continuum of care, where the funds follow the child, with the goal of keeping kids home whenever possible, or getting them back to a safe, happy, and permanent home as soon as possible. Boys Town is the national leader in these system reform efforts, but states are slow to change, and national legislation is hard to influence. The first thing Boys Town would do with additional resources is grow our integrated continuum to scale in more communities. Right now, Boys Town offers great programs that produce positive outcomes for individual children and families. But at most of our sites, these services do not form an integrated continuum. We already achieve positive outcomes in communities where we have programs, but we need to prove our continuum can be replicated and to influence other communities to develop their own. Second, Boys Town would use additional resources for research. Boys Town would fund the kind of innovative research that challenges the status quo and proposes new system designs. Anecdotal evidence and compelling stories of success are great, but in the end, hard data wins the day when it comes to influencing government policy and system reform. Third, Boys Town would use additional resources to grow our marketing efforts. Boys Town has discovered that marketing is the key to creating system reform. If you have a great story to tell and no one hears it, you won't make a real impact. We need more resources to effectively promote our integrated continuum to parents, community leaders, child advocates, legislators, and government human service officials at the state and national level, if we are to ever truly change the way America cares for children and families. The first gap Boys Town would fill is the care gap. Due to cuts in state funding, Boys Town is seeing more cases where the length of a child's stay in our residential care program is falling short of the optimal length of 18 months or longer. The care gap is the difference between the length of stay our research shows is needed for kids to get better and stay better, and the length of stay covered by state funding. Our goal is to prove that a child with the right care at the right time actually saves money for the states in the long run because of lower recidivism rates. The second gap Boys Town would fill is transitional living services. Boys Town does not currently offer a transitional living program for children who are aging out of residential and foster care services. Because of this, many kids in foster care turn 18 and then go on to become homeless or break the law and end up in prison. These programs could help youth stay on the path to becoming good citizens after state services end. Boys Town could use extra funding to develop these transitional living services and to seek corporate partners that could prepare youth for the workforce by providing training and job experience. The partners could then hire these youth as they transition into independent living. The third gap Boys Town would fill is a need for more pilot projects to promote our integrated continuum of care. For example, Boys Town proposes to offer our integrated continuum of health care and youth care services to all needy families within a specified geographic area. This pilot project would then be studied carefully to test whether or not it improved outcomes while lowering social service, medical, and educational costs for the community. We have achieved this kind of success in a few areas and need to prove we can do it across the nation.